Hi, I'm Natalie from ATMS. Welcome to Natural Medicine Week. Today is day 2, and I am joined here with an interview today by Amy Tyler. Amy is a remedial massage therapist who specializes in working with people who have had cancer diagnosis or cancer treatment. With 20 years experience and training, she's become known in the industry for a unique skill set and has trained many other therapists to specialize in oncology massage. And Amy is also the founder of the Institute of Oncology Massage. Welcome, Amy.
Hi, Nat. How are you today?
Good, thank you. Thanks for joining me today. So we're going to be talking a bit about oncology massage. So what are the different types of therapeutic massage during and post, cancer treatment?
Well, I suppose I kind of liken it to sports massage a little bit. So we know with sports massage, we have like pre-game is different to post-game, is different to rehabilitation, and is different to conditioning massage. I feel like oncology massage is a little bit the same. So during treatment, we have the treatment phase, which we're going to be a lot lighter in what we do. It's going to be eliciting the relaxation response, much more calming style of treatment. Then once you come out of treatment, there's going to be some rehab stuff that we need to do just to get you into a better quality of life. Then, of course, if you're thriving post-cancer, you can still have some long-term effects or you can have late effects, which we need to adapt for. Now, it doesn't mean that it's going to be the same style of treatment that we did during your treatment phase, though, or that it's that rehab style. You could be coming in for things just like your daily living, tension, shoulders and neck from too much computer work, things that we all just get in life, right?
Yes.
We need to adapt the massage based on a past history of cancer. Mm-hmm. And then lastly, we have things like people who are terminal, so they're in palliation or maybe even towards end of life. So that's yet another kind of style of treatment we might do, and is probably a little bit more similar to what we might do during the treatment phase of cancer itself. So what you get at one point in time is not necessarily the same type of treatment you're going to get throughout your life once you've had a cancer diagnosis.
Yeah, absolutely. You've got to adapt it for that individual and for what they're experiencing, as you said, or going through as well. And so going through the treatments, what would some of the benefits be if somebody is having massage while they are going through treatment?
All right. So, of course, depends on what type of treatment they're having. So chemotherapy is one of the common treatments, and you will have many different side effects of chemotherapy. Some of the things that you might not consider for a massage therapist could be bowel dysfunction. So chemotherapy really affects the gut, and unfortunately things like constipation can be quite painful. So an abdominal massage can actually be hugely beneficial during chemotherapy. We have things like nauseousness as well that can also be reduced by gentle massage. Now, the trick is to not do too much massage and actually make you more nauseous. So there's a fine line, and that's where a skilled practitioner is going to be able to adapt the treatment appropriately. Peripheral neuropathies, so hands and feet, you can get tingling, pins and needles, numbness, textural changes, and it can be quite painful. So being able to have some gentle massage again on hands and feet during that time frame is really beneficial. And the trick is, again, not too much, because actually too much can flare the syndrome up and cause a bit of a problem, which is not what you're after when you've already got something kind of that's negatively impacting your life, I suppose. So those are 3 things that you might not necessarily think about for massage. The other ones would be anxiety and depression, which no matter what type of treatment you're having, just simply knowing that you're going in for your next treatment. So it might be a surgery, it might be the next round of chemo, or it could just be the next radiation therapy. Sometimes even just for follow-up scans, that anxiety can be quite high. So coming in for a massage just prior to that treatment or scan can be hugely beneficial in just calming the whole system down. and making that person less anxious leading into treatment. So those are the kind of the common things I suppose I see people in clinic for. Fatigue is something that, yes, occurs during treatment, but also occurs post-treatment. The massage can just help give a little bit more energy. Even the day of, you're going to have the blissed out kind of relaxed sensation, but you're not actually wiped of energy. The next day after a massage, hopefully you have a bit more energy due to having had the massage. So yes, during treatment, those are probably the most common things. With radiation therapy, it's usually things like range of motion that are impacted, tightness within the tissue. And then we just have to be very careful because that radiated area is quite fragile for quite some time. So it's just applying some gentle techniques to the region once it has healed enough post-radiation to then increase range of motion in the tissue, be able to get more movement happening and not feel so stiff and tight in that area.
Brilliant. There's so many benefits if someone's going through treatment. Absolutely. And then someone comes out, from treatment, so they're in that post-treatment phase. What are some other really good benefits you see for oncology massage as well?
So general quality of life is what we kind of aim at with all of our treatments. So anything that is left over from treatment, any of the side effects are what we would be looking at trying to reduce. But I suppose in that post-treatment phase, it could be things like your range of motion. So if you do have scars or if you have radiated tissue that is restricting joints or muscles, not just necessarily right at the radiated site or at the scar, but it could be further afield. Getting that range of motion back into tissue so you can go back to daily activities. Things like if you have had a mastectomy and radiation, being able to reach the arm up to grab the coffee cup off the top shelf, being able to put your hands above your head to dry your hair. They're just daily living things that we should be able to achieve. And getting that range of motion back into tissue can be really important. For anyone who's had the abdominal, pelvic, if there's any scarring there, twisting, turning, bending can be restricted. So things like getting in and out of a car might be an issue. So we would look at softening that scar tissue and just helping that person achieve those things without pain. Chronic pain, unfortunately, is something that a lot of people post-treatment live with. And I do believe a lot of it does come from that tension within scar tissue and radiation, and is something that we don't necessarily need to live with, especially if that is the cause. So oncology massage can be really beneficial in reducing pain. And of course, that reduces pain medication. So the benefits of that can be huge. But as I said, general daily life, we all get stressed. We all have things that go wrong in life. And we all have anxieties based on different things at different stages. Now, of course, years down the track, cancer patients are still having scans for checkups, and that time can be quite an anxious time for them again. So in that time frame, coming in just for more mental health side of things, massage is wonderful for that. So having some appropriate massage, even though you might be years down the track, just to ease you going into your follow-ups can be really important.
Oh, brilliant. So many health benefits from pre-treatment, post-treatment, even once they find out as well. That might be, as you said, to ease those anxieties and stress as well, to quality of life moving forward. Thank you for sharing it today. And I wanted to also say that you are an ambassador for Natural Medicine Week, and you're doing so many things this week as well and sharing so much across your channels. So I really appreciate your time today.
My absolute pleasure, Nat. It was lovely chatting.